Hello future nurses, today we are going to go over chapter 35 in your F.A. Davis textbook, Fundamentals of Nursing Care. This chapter focuses on researching and preparing medications. I suggest that as we go through the chapter, follow along in your book. A single medication may be called by three different names, which are chemical, generic, and brand or trade names. Chemical names tell us the exact ingredients of the medication, for example, 2p-isobutylphenyl propionic acid. Generic names are assigned by the U.S. Adopted Name Council. These names may include shorthand version of the chemical name, for example, ibuprofen. Brand or trade names are typically owned by the pharmaceutical company. These are short and easier to remember. They are capitalized and often registered, requiring a trademark symbol to be used in print. For example, in the above example, we will have ibuprofen available as Motrin, Advil, Medipren, and Pediaprofen. Two general categories of medications are prescription and over-the-counter. Prescription medications are available through a written direction from healthcare providers with prescriptive authority. These may include physicians, nurse practitioners, and physician assistants. The prescription should include patients' and healthcare providers' information, name and dose of medication, instructions to pharmacist, and any special instructions and directions to patient. Over-the-counter medications are available without prescription. These are also called non-prescription medications. Before becoming available over the counter, the dosage of a medication must be determined safe. Stronger dosage of the over-the-counter medications require prescription. For example, ibuprofen is available over the counter in 200 mg tablets. At the same time, they are available in 800 mg tablets with prescription. Medications can be taken by several routes. It is imperative that we know by which route a medication has been ordered. Oral medications are taken through the mouth. They are either swallowed or placed in the buccal cavity between cheek and gums. Sublingual route requires the medication to be placed under the tongue and the medication is absorbed. ODT stands for orally disintegrating tablet. In the mucosal route, the medication is absorbed through the mucosa, that is, the rectum, vagina, ears, eyes, and inhalation into lungs and bronchi. Topical medications are applied to the skin. For example, creams, ointments, lotions, and transdermal patches. Parenteral medications are given beneath the skin, and these include injections such as intradermal, that is between the layers of skin, subcutaneous beneath the skin, and intramuscular within muscle layers, and intravenous into the vein. Many laws have been passed regarding medication quality and safety. The following 4 laws impact the way drugs are developed, marketed, stored, and named today. The first law is Food, Drug, and Cosmetic Act of 1938. A government agency was established to approve all new drugs and determine that the drug was safe for humans. This agency became the US FDA. The Durham-Humphrey Amendment of 1952 specified the criteria for prescription medications and over-the-counter medications. The Kefauver-Harris Amendment of 1962 established the FDA as responsible for giving drugs official or generic names and specified criteria for deeming a drug safe and effective before it is offered for sale. The Comprehensive Drug Abuse and Control Act of 1970 established Schedules 1 through 5 categorizing drugs according to their potential for abuse, set guidelines for the manufacture, distribution, and sale of controlled substances, addressed the need for treatment for drug abuse and dependence, and made it illegal to possess a controlled substance without a legal prescription for it. In this box, you can see the scheduled drugs with examples. Schedule 1 drugs are highly addictive and have no medical purpose. Therefore, they are sometimes referred to as street drugs. For example, heroin, LSD, etc. Schedule 2 drugs have high potential for abuse and do have accepted medical use. For example, morphine, codeine, fentanyl, oxycodone, and methadone, etc. Schedule 3 drugs, while having the potential for abuse, are at less risk to be abused than those in Schedules 1 and 2. For example, lower doses of barbiturates, acetaminophen with codeine, etc. Schedule 4 drugs have a lower potential for abuse than Schedule 1, 2, and 3 medications. For example, central nervous system depressants such as chloral hydrate, diazepam, lorazepam, etc. Schedule 5 drugs have the lowest potential for abuse. For example, medications with very small amounts of codeine and atropine such as cough medications with codeine, and antidiarrheals such as diphenoxylate with atropine or Lomotil. A prescription may not be required for these medications, but the consumer will sign for the medication and provide identification when purchasing it. Medications are prescribed to achieve a specific effect, but along with the intended effect, other effects may also occur. Desired effect is the reason why the medication is prescribed, for example, treating hypertension. Side effects are unintended outcomes, but they may also be expected with some medications. For example, a medication that has been prescribed for hypertension may cause dizziness. Adverse effects are unintended but are more severe or harmful than the side effects. These are unexpected at normal medication dose. Severe adverse reactions are life-threatening. Allergic reactions occur when body reacts to medication as a foreign invader to be destroyed. Generally, taking medication for the first time has no reaction, but antibodies may be made. However, taking the same medication the next time may result in an allergic reaction. Anaphylaxis is a more severe reaction. It is life-threatening. Patients experience swelling of airways, shortness of breath, respiratory arrest, decreased blood pressure, and eventually circulatory collapse. Immediate reaction occurs if medication is administered via IV. Stop medication at once and follow facility procedure for response. Check the chart for allergies. Therapeutic level is amount of medication in the blood needed to achieve the desired effects on the target organ or organs. Toxicity occurs when there is too much medication in the body. It may lead to multiple organ failure and death. Drug interactions may occur with other medications, with certain foods, and with vitamins and herbal supplements. When drug interactions occur with other medications, there is a decrease or increase in the desired effect. For example, warfarin or Coumadin is an anticoagulant that prevents blood clotting, while aspirin or ibuprofen also have the anticoagulant properties. Taking warfarin with one of these medications may lead to bleeding, which can become life-threatening if not reversed. When drug interactions occur with certain foods, we may either avoid foods or beverages while taking a medication, or avoid taking medication with certain foods or beverages. For example, tetracycline is an antibiotic which should not be taken with dairy products, as the proteins in dairy lead to decreased absorption. Drug interactions with vitamin and herbal supplements interfere with effectiveness. For example, St. John's wort decreases the effectiveness of birth control pills and decreases the excretion rate of narcotics from the body. There are several ways we can research medications. Nursing drug guides are specific for nurses and include generic drugs listed in alphabetical order with information about their classification and brand names, absorption, distribution, metabolism, and excretion, indications for use, dosages, contraindications, cautions and interactions, nursing interventions, and patient teaching. The Physician Desk Reference, or PDR, is a comprehensive book containing detailed information about a large number of medications. Pharmacology textbooks include classification of drugs with explanations of the effects and uses for each class. Now that we have so much information available of internet, we want to be sure to use a reliable site to get our information. Most of the information that we'll find on these sites are written for patient, not for nurses or other healthcare providers. In your F.A. Davis book, Fundamentals of Nursing Care, 3rd edition, you will find Table 35.1 on pages 780 through 784, which gives us a classification and effects of medications. Please go through this table and we will discuss this further in class. As we discussed earlier, the prescriptions are written by healthcare providers with prescriptive authority. The prescription should have date and time of the order, name of the medication, either generic or brand, dosage of medication, frequency for taking the medication, route of administration such as oral, intramuscular, or intravenous. Prescription should also include patient's name, specific reason for administering the medication, and signature of the prescriber. Healthcare providers' orders are typically transcribed to MARs. Medication Administration Record, or MAR, lists the medications and the times they are to be administered. They may be on paper or may be computerized. There are places for nurses to record administration of the medication. Although computerized ordering systems are designed to reduce human error, we should always compare the order on MAR with the prescriber's original order to detect any possible errors before preparing and administering medications. Apothecary system of measurement is an older system that is not recommended by the Joint Commission as it can cause confusion. Metric system is the more accurate and standardized. The household system is the measurement system used with cooking. It can be useful when discharging patient to home with liquid medications. At times, you may need to calculate or check a dose for the patient. For example, the prescriber may order a 5 mg dose of a medication and the pharmacy only carries 10 mg tablets. As the nurse, you will have to figure out how to administer the correct dose. On this slide, you're looking at one of the formulas that can help us get to the correct answer. H is the dose on hand, D is the ordered dose, V is the vehicle, for example, tablet, capsule, or liquid. X is the desired amount of vehicle for the ordered dose. So here is a question for you. The physician orders amoxicillin liquid 500 mg per feeding tube every 6 hours. We have available amoxicillin 250 mg per 5 ml. How many mLs should be administered in one dose, and how many mLs will the patient receive in 24 hours or in one day? We know the formula, so let's plug the numbers in. So it will be 250 mg divided by 5 ml equals 500 milligrams divided by X. Now you want to cross multiply. So you will have 250 mg multiplied by X equals 500 milligrams times 5 ml. To solve for X, you want to divide both sides by 250 mg, which will give us 10 mLs per dose. To answer the second part of the question, we have to figure out how many doses will be administered in 24 hours. If the patient is getting the medication every 6 hours, then that means they get 4 doses in one day. Multiply the mLs per dose by 4, and that will give you 40 mLs per day. Many acute care facilities use computerized cabinets for inventory control and safe medication storage. Every facility has its own system for dispensing medication. However, generally you need a password to access the medications. Typically, you enter a patient's name and a list of ordered medications will appear on the screen. You will choose the medication or medications you need, and the drawer or drawers will open to allow you to take medications. Once the drawer closes, the medication is charged to that patient. Medication carts may be used in some acute and long-term facilities. In the hospital, the carts are restocked by pharmacy every 24 hours. In long-term care, the pharmacy supplies 30-day punch cards that are kept in the resident section of the drawer. Narcotics are kept under double lock. Always lock the med cart when not taking medications from it. Some settings may keep locked bins in patients' rooms. Narcotics are kept in the medication room under 2 locks. I know this is a little different than your textbook, but at Deltec Hospital, we will be using this list for all your medication administration skills. We have to check the 7 rights of medication before medication administration. This is to prevent medication errors. So you want the right patient. You want to use 2 identifiers to identify your patient. Typically, it's the name and date of birth. You want to use the right medication. Verify that you have the correct medication by reading the label and comparing it with the MAR. Do not identify medication by their size, shape, and color, as many drugs have similar appearances. You want to have the right dose. Pay close attention to the placement of decimals because this can cause overdosing or underdosing if you misread it. You want to have the right route. Pay close attention to the ordered route. If a medication is administered by the wrong route, it is considered a medication error. You want to have the right time. Be aware of when the medications are due and administer them within the 1-hour window. You want to have the right documentation. Document all medications given or not given according to the facility policy. Patients also have the right to refuse medication. They can choose not to take the medication and should not be judged negatively for their choice. Patients also have the right to know the purpose of medication, to know the effects of the medication, like we said before, right to refuse, and they have the right to question the medication. If the patient questions a medication, research it thoroughly before administering it. This is an important safety check regarding the correct administration of medications. While preparing medication, stay focused on the task at hand. Ensure that there are no distractions, such as idle conversations or interruptions. When preparing meds, you will obtain all the medications ordered for a patient at the time they are to be given. It's best not to prepare medications for 2 patients at one time because it is too easy to get confused. To prevent errors as we prepare medications, perform these 3 safety checks. Verify the medication, dose, route, patient, indication, date, and time as you remove the medication from the cart, bin, or Pyxis machine. Verify the medication, dose, and route against the MAR prior to placing it in the medication cup and returning the container to the drawer if applicable. You want to also verify the patient, medication, indication, dose, and route at the bedside prior to opening it and administering it to the patient. Some medication names and doses can be very confusing. Like we said before, you want to stay focused on the task when preparing medications. You want to read the drug names very carefully, as the drug names could be similar and can be confusing. You want to read doses very carefully, especially those with decimals. Look for a 0 in front of the decimal to call attention to its presence so that it will not be overlooked. Never administer a medication you are unknowledgeable about. If you do not know what the medication is for or what the expected effects are, you must look it up. Even if it is inconvenient and time-consuming, you must know what you are administering and if the dose is within the appropriate range. Prepare medications for only 1 patient at a time. And if the order is unclear, outside of usual dosage parameters, or seems inappropriate for the patient, clarify the order with the prescriber. The Institute for Safe Medication Practices, ISMP, exists to improve medication safety by educating the healthcare community and consumers about safe medication practices. They have developed guidelines for various issues identified to likely cause errors in medication administration. ISMP and U.S. Food and Drug Administration, or FDA, have developed a strategy to prevent confusion between medications with similar names by using tall man letters. Please review the FDA-approved list of generic drug names with tall man letters provided in your textbook in box 35.6. In case a medication error occurs, be honest and report following the facility policies. Even if another nurse has made the error and you catch it, you're still required to report the error and follow facility policy in completing incident report. This brings us to the end of this lecture. If you have any questions, please email me or bring your question to the class and I'll be happy to discuss it with you. For now, bye and study hard.